You probably have seen my other videos on stress and adrenal fatigue. I've done quite a few. In this video, I'm going to talk about the non-stress cause of adrenal fatigue. Now, so many people are stressed out and they're burnt out, but some people have adrenal fatigue and they really haven't been through stress. And they're wondering, why did I end up with an adrenal issue with no stress? So there's another cause of this. But before I get into that, let me just tell you what the adrenal gland does. The adrenal gland has two parts, an outside and an inside. The inside is all neurological tissue. It makes neurotransmitters. It's called the adrenal medulla. The outside is all glandular, and that makes hormones like cortisol and a few others. Now, the adrenal medulla is primarily part of the autonomic nervous system, specifically the sympathetic nervous system, which is the flight or fight. You have the opposing system called the parasympathetic, and that is located in your brain stem. It's located in a few other places, but for this video, we're just going to focus in on the adrenals and also the brain stem. So the parasympathetic nervous system, which is located in the brain stem, kind of counteracts the sympathetic flight or fight mode. So it's all about rest, digest, and recovery. So if you experience stress, you can activate the adrenals and eventually wear out the adrenals. But what about if you lose the parasympathetic control? What happens then? Like you lose your brake pads and from a non-stress source. Well, that can actually create a sympathetic dominant problem where you're kind of stuck in stress and you have all the symptoms. And so the brainstem is very sensitive to thiamine, B1 deficiencies. So when you're deficient in B1, you can have all sorts of problems with the brainstem, specifically a lack of adaptation to stress, because the autonomic nervous system then starts becoming dysfunctional. So one real simple way that you know that that system is involved is if you stand up too quickly and you get dizzy or you might pass out. There's a severe condition called POTS, which also falls in this category, but so many people get up from a seated position or they get up too quick and they're like, whoa. And that could be an electrolyte problem where you're low in salt or potassium, but it can also be a B1 deficiency because the brainstem needs B1 to work correctly. Being B1 deficient can create a lack of adaptation to gravity stress, and it can affect your ability to tolerate stress in general. So it's not just about physical stress, it could be about adapting to mental stress as well. As you may already know, a B1 deficiency can create anxiety and fatigue, very similar to having just an adrenal gland that's burnt out and having high levels of cortisol. So it's very, very similar. The problem with vitamin B1, it's water soluble and it doesn't store for very long. I mean, you could be completely depleted within 18 days of not consuming vitamin B1. However, it's not just about not consuming B1, it's about certain things that actually directly create a deficiency. The biggest thing is refined carbohydrates, whether it's grains or sugar. That will create a huge problem. And also, the more carbohydrate you consume, the more the demand for B1. So if you consume a lot of carbs, you're going to need a lot of B1 to be able to metabolize those carbohydrates. Also, alcohol is a big B1 depleter. Coffee can create a B1 deficiency. So those jittery feelings that you might feel if you drank too much coffee, if you took B1, boom, goes away. Tea with its tannic acid can create a B1 deficiency. Sulfites, which are in wine, so we combine the alcohol and the sulfites, can deplete your B1. Antibiotics, I've done a video on that, can create a B1 deficiency. Diuretics can create a B1 deficiency. Metformin, the drug for diabetes, can also create a B1 deficiency. So in summary, the symptoms of adrenal fatigue are very, very, very similar, if not identical, to the symptoms of a B1 deficiency.
Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call. But I put the number down below so you can call and get some help.